June is Scoliosis Awareness Month, and if you have kids or teens at home, this is information you're definitely going to want to hear. Scoliosis often starts showing up during growth spurts, but early detection can help prevent serious problems down the road. Joining us now is Dr. Arash Emami, an orthopedic spine surgeon, to break down the signs of what to watch for and how early action can often help kids avoid surgery altogether. That is a mouthful. You are not. It's so nice to speak to you.
Thank you so much. It's a pleasure to be here.
As we started talking about this, folks around the newsroom were like, oh yeah, oh yeah, oh yeah. So for those who may not know, what exactly is scoliosis?
So scoliosis is a condition where the spine starts bending and curving to one direction.
Okay.
Most of the time, the cause is really unknown. There's a strong genetic predisposition to this, okay, so that if, as an adult, you have scoliosis, your child is more likely to have one as well. Mm-hmm. Oftentimes it's noticed during teenage years and preteen years. The early signs are typically during that time frame that one can detect it.
Okay, and speaking of signs, what are some of the signs that we should be looking out for?
So there may be some subtle signs initially that you can look for. There may be some slight shoulder asymmetry that you can notice in the child. Okay. There may be some hip sort of subtle differences in the hip position. One hip may be sticking out a little bit more, being a little bit more prominent. There may be waistline sort of being uneven in the child. Those are all indications that there may be a scoliosis. Sometimes wearing your clothing, it may be uneven, one side versus the other side. So those are some subtle signs that you can look for. And there's usually an easy test where you can have the child bend and lean forward. By doing so and examining the back, you can sometimes see a prominence on one side versus the other. That may indicate that there may be a scoliosis.
So interesting. Is scoliosis preventable at all?
So it's really not preventable, but with early detection and intervention, we can minimize the risk of progression substantially. So that's why it's important to sort of look for it early on. It's important to have annual checkups with physicians and pediatricians to screen that so that we can intervene and prevent progression.
Okay, so what if our child or teen is actually diagnosed with scoliosis? Is surgery absolutely necessary?
So the good news is that most of the time you do not need surgery for these conditions. Majority can be treated conservatively, oftentimes with a brace, physical therapy, or sometimes just simple observation is all we need to do. But it's important to diagnose it early on so that we can intervene early and prevent the scoliosis from progressing and getting to a stage where it would require surgery.
Unbelievable. Thank you so much. That was chock full of information. Now I know why my pediatrician was making my children bend over and walk across the room and come back. I appreciate it.
My pleasure. Thank you.
Absolutely. Dr. Emami has chock more of helpful information, and if you would like some, go to Scoliosis, scan the QR code, or visit universityspinecenter.com to book an appointment.